Hello, Srinidhi.
Good evening, Jaspal sir.
Good evening, Srinidhi.
Yes, sir.
Okay.
Shall we start with 5 minutes, sir? Few people are trying to join. Hello.
Jaspal sir, namaskara.
Okay, Srinidhi, we'll wait. Don't worry.
Sure, sir. Sure. Sir,
Jaspal sir,
Veerbhadra has
namaskara.
joined the meeting.
Sir, namaskara, sir. Namaskara, sir. Good evening, sir.
ಆರಾಮಿದ್ದೀರಿ ಸರ್?
ಆರಾಮ್ ಸರ್, ತಾವು ಆರಾಮಿದ್ದೀರಿ
ಏನ್
ಸರ್?
ಕಾನ್ಫರೆನ್ಸ್ ಮಾಡ್ತಾ ಇದ್ದೀರಿ ಅಂತ ವಿಷಯ ತಿಳಿದ ಎಲ್ಲಿ ಮಾಡ್ತೀರಿ?
ಸರ್, ಇದು
ನೆನ್ನೆ ಮೀಟಿಂಗ್ ಅಲ್ಲಿ ಚರ್ಚೆಗೆ ಬಂತು.
ಹೌದು ಸರ್, ಬೆಲ್ಗಾಂ ಅಲ್ಲಿ ಪ್ಲಾನ್ ಆಗ್ತಾ ಇದೆ ಸರ್. ಬೆಲ್ಗಾಂ ಅಲ್ಲಿ.
ಬೆಳಗಾಂ ಅಲ್ಲಿ ಮಾಡ್ತಿದ್ದೀರಿ?
ಹಾ ಸರ್.
ಓಕೆ, ಒಪ್ಕೊಂಡಿದಾರಾ?
ಸರ್, ಬೆಳಗಾಂ ಅಲ್ಲಿ ಒಪ್ಕೊಂಡಿದ್ದಾರೆ ಸರ್. ಈಗ
ಹಾ.
ನ್ಯಾಷನಲ್ ಲೆವೆಲ್ ಇಂದ 2 ಮೀಟಿಂಗು ಆಗಿದೆ.
ಓಕೆ ಓಕೆ.
ಅಂಡ್
Good.
ಆಕ್ಚುಲಿ ಏನಿದೆ ಅಂದ್ರೆ ಸರ್, ನ್ಯಾಷನಲ್ MSN ಇಂದ ಫಸ್ಟ್ ಆಫ್ May onwards, new team is going to take over, sir.
ಓಕೆ ಓಕೆ. ಹಾ ಹಾ.
So they are waiting for the changeover to send us all the further proceedings, sir.
ಓಕೆ ಓಕೆ.
The outgoing team has had 2 meetings with the previous group of people who are involved, as well as they have discussed about a few aspects. That is the venue and everything that they are interested. Actually, JNMC people have taken initiative themselves, sir.
ಓಕೆ ಓಕೆ. ಹಾ. ವೆರಿ ಗುಡ್.
So things are proceeding in that way, and let us see, sir, how like the new team is going to get involved, and we'll go ahead, sir, with this.
ಸೊ ನಾವು ಎಲ್ಲ ಕಾನ್ಫರೆನ್ಸ್ ಮಾಡ್ದಂಗ ಆಗುತ್ತೆ ಈಗ ನಾವು.
How, sir,
JD
Yella conference, sir? This is going to be a national level conclave in Karnataka, sir.
JD ಸೌತ್ ಝೋನ್ ಹೇಳಿದ್ರು.
ಹಾ ಸರ್.
ಅದು ರಾಮನಗರದಲ್ಲಿ ಮಾಡ್ತಾ ಇದೀವಿ.
ಹಾ ಸರ್.
ಚಾಮುಂಡೇಶ್ವರಿ ಮೆಡಿಕಲ್ ಕಾಲೇಜಲ್ಲಿ.
ಓಕೆ ಸರ್.
ನಮ್ಮ ಮಲ್ವೇಗೌಡರು ಒಪ್ಕೊಂಡಿದ್ದಾರೆ.
ಹಾ ಸರ್. ಹಾ ಸರ್.
ಅಂತ.
Okay.
So we'll have many
activities for this year, sir.
Yeah.
Many activities, and that too, national level activities we will be doing, sir.
Yeah.
Yes.
And we are also conducting national level IMA AMS conference.
AMS, yes, sir. Yes, sir.
Yeah.
That
all
also,
national level.
all national level falling in the lap of Karnataka this year, sir.
Yeah.
Yes, sir.
We go for the best.
Yes, sir. We need your support and all your.
I am always there.
Wishes, sir. Yes, sir. We are 33 joined, sir. Now we'll.
Yeah. You can start now. Pawan
is here. Naz madam is here.
Let Pawan come, sir.
Yes, sir. Yes.
He is joined, but he is busy with something else, I think.
Yeah, he has joined, but I think he is getting ready with his slides.
Let him join.
Yes, sir.
We'll start.
Jaspal, I am also ready.
Yes, sir. Sir, namaskara.
Yes, sir. Patient ಎಲ್ಲ ಮುಗಿಸಿದ್ರಾ ಸರ್ ನೀವು?
Sir,
sir, Madhu sir.
Patient ಎಲ್ಲ ಮುಗಿಸಿದ್ರಾ?
ಇನ್ನ ಮುಗಿಸ್ತಾ ಇದೀವಿ ಸರ್ ನಮ್ದು ನಿರಂತರ.
Okay.
Yes, sir. I'll be in line.
Okay, sir.
Roaring practice in Sirugupa.
ದಿನಗೂಲಿ ನೌಕರರಪ್ಪ.
ನಾವೆಲ್ಲ ತಿಂಗಳ ಲೆಕ್ಕದವ್ರು ಅಂತನಾ?
Good evening, sir.
Good evening, Pawan.
Yes, sir.
ಪವನ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬೋದಾ?
ಮಾಡ್ಬೋದು ಸರ್. Yes, sir.
Okay. Sir, Jaspal sir, you can start now.
Yes, sir. We'll start, sir, now.
Yes.
Srinidhi.
Yes, sir.
Yeah, please start with the proceedings.
Sure, sir. Thank you. Mokshit, are you there in the meeting? Mokshit?
Yes, sir. I'm live. Shall we start, sir?
Yes. Go on.
Uh, Good evening, ladies and gentlemen, esteemed office bearers, my dear seniors, faculty members, and my dear colleagues. I'm Mokshit, the head of Mental Health Subcommittee, IMA MSN Karnataka. It is an absolute honor to welcome you all to this insightful session titled Moments That Matter, Crisis, Communication, and Safety in Clinical Practice. As medical students and dementia practitioners, we often focus on cure, but today we shift our focus to the care, the critical moments of communication and safety that define our professional integrity and patient outcomes. Before we delve into the core of our session, I'd like to first extend very warm and respectful welcome to the leadership of IMA Karnataka, whose constant support fuels our student initiatives. I'm privileged to welcome uh, the president, IMA Karnataka, whose vision guides us as our state branch towards excellence. Uh, uh, Good evening, sir, Dr. Veerbhadra, sir.
Thank you.
I'd like to
Go
extend
ahead,
my
go
warm
ahead.
welcome.
Thank you. Go ahead.
Thank you, sir. I'd like to extend my warm welcome to the chairman of IMA Karnataka for being the pillar of our strength and mentorship. Please welcome, sir, Dr. Jaspal Singh, sir.
Thank you, Mokshit.
Thank you, sir. Good evening, sir.
Good evening.
Uh,
You can take over with the president's address first, and then.
Yes, sir. Sir. So we have with us our president of IMA MSN Karnataka. Sir, good evening, sir. Please do share your thoughts about today's session, sir, with us.
1 second. Before we start, Mokshit, I am a prayer
Sir.
and I am a.
Sir,
yes.
Sir, it'll be continued, sir. Yes, sir.
So start with I am a prayer.
Sure, sir. Yes. So to begin this evening on an auspicious note, I invite General Secretary of IMA MSN Karnataka to lead us in the prayer. Swapnil sir, I invite Swapnil sir for the prayer.
Thank you, Mokshit. Good evening, everyone. Myself, Swapnil Sena, General Secretary of IMMS in Karnataka. IMA prayer. May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. May we be the healing cure beyond every greed and love. Thank you.
Thank you, sir. To reaffirm our commitment to our nation and medical profession, I request our National Committee member, Ms. Vedika Verma, to give a flag salutation.
Thank you, Mokshit. We members of Indian Medical Association stand here to salute our national flag. It's our honor and glory shall be our light and strength, and its course shall be our course. We pledge our allegiance to it and realizing our responsibilities as accredited members of this national organization, we swear we'll dedicate everything in our power to see it fly high in the Committee of Nations. Thank you.
Thank you, ma'am. So now, before we delve into this session, I request our president, Dr. Veerbhadra sir, to please deliver the presidential remarks.
Good evening, everyone. I don't take much of time. It is a good topic actually, and our friend Dr. Pavan will narrate in a nice manner. So it is very useful in our day-to-day practice. So please listen to him, and we'll have take-home message from him also. And I welcome Dr. Pavan Patel for this session. Let the session be fruitful. Thank you very much.
Thank you, sir.
Thank you, sir. Now, before we introduce our speaker, I'd like to request Dr. Madhusudan sir, the past president of IMA MSN Karnataka, please share your valuable thoughts with us, sir.
No. Kindly carry on. Let us not waste time. Let us listen to Pawan.
Sure, sir. Thank you, sir. Now, finally, it's my distinct pleasure to welcome our guest speaker for the evening, Dr. Pawan Kumar N. Patil, sir. With his vast experience as general surgeon and director of Gadag Scan Center and Heart Center, we're eager to learn from you, sir, and from your insights on handling tense clinical situations and medical legal awareness. Please welcome, sir. Good evening, sir.
Good evening. Good evening. Good evening, everybody.
Now I request Srinidhi, the state co-convener, to please formally welcome Dr. Pawan Kumar Patil, sir.
Good evening, sir. Good evening, Dr. Pawan Kumar and Patil, sir. It is my privilege to introduce Dr. Pawan Kumar and Patil, sir, to today's webinar. Sir is an accomplished MS general surgeon with a fellowships in minimal access surgery and gastrointestinal endosurgery. He has extensive experience in oncosurgery, urology, and trauma care, and currently serves as a managing director of Dr. N.B. Patil Hospital, Gadag. Dr. Patil sir is also deeply involved in medical legal advocacy and healthcare policy through the Indian Medical Association. So we are very pleasure to have the sir for today's session. We welcome you, sir.
Thank you.
And I request you to take over the webinars.
Yeah, thank you. Good evening, everybody. It's my pleasure and fond interest in talking on this topic, and that too for young budding physicians or surgeons or any clinicians, doctors in a whole. So it is a very good topic that MSN has chosen for today's lecture, that is crisis, communication and safety in clinical practice. I stand before you as a clinician. I'm a general surgeon doing minimal access surgery, advanced procedures. I am also an entrepreneur considering my hospital, the scan centers and other specialty centers, which I am part of it. And I also stand before you as a member of Karnataka Medical Council, where we take care of regulatory authorities for the medical professionals. So after being a member in Karnataka Medical Council or before that, my interest was in medical legal aspects of clinical practice. So combined these three experiences, I feel enlightened to share my thoughts and experiences with the young budding doctors in our state. So I welcome and I thank the MSN team and Dr. Jaspal for having me deliver this talk. Coming to the topic, crisis communication and safety in clinical practice. Each point of this is a separate topic as such. So I'll not go into details about each topic, but I would like to summarize all these three into one nutshell and finish this talk in just next 40 minutes. I'll be talking in various these headings, which will come in due course of time. Let us start with why this topic does matter in for the young budding doctors. A lot of negative thoughts about the profession has been circulating day in, day out through WhatsApps, through media, which brings down the moral of the young budding doctors for having chosen this profession. So a lot of them, after their MBBS, they either switch to a different profession or practice with a fear. So to forego that, this topic is very essential. Lack of knowledge or failure of communication is the key for all the problems what we face and what we hear in day-to-day WhatsApp circulations. Many medical crises, they don't begin in ICU. It is not because you did something wrong or you had a complication during your treatment. That is part and parcel of any profession. Like a driver, for example, if I want to give, a driver might, if he says that he has never had any accident, even minor accident during his lifetime, I would not believe him. So having complications, having untoward incidences in the hospital is part and parcel of any profession for that matter. But that is not the sole reason for the difficulties we face in day-to-day practices. It is not that what happens in ICU or OT, but it is the conversations which go wrong. That causes a significant problem in our day-to-day practices. A simple example I would like to give is we recently had a case in the council where the complainant visited a diagnostic center. They got their ultrasound done. They received the report outside on the reception. They felt that there is something wrong in the report. So they wanted to discuss this with the doctor. But what happened is the receptionist staff said, no, 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 doctor is busy. You cannot see them. And they were not allowed to see the doctor. The mistake in the report was she had undergone removal of one side of ovary, but by typing error, it was mentioned that both ovaries are seen and are normal. So she wanted to clarify. See, there is a simple typing error by the technician who types the report, and it was signed by the doctor in a hurry without seeing that. So if the patient had just 2 minutes of time with the doctor, he would have reconfirmed her ultrasound and corrected the report then and there. So for the 2 minutes of conversation which was avoided by the doctor didn't avoid, but the receptionist, your team, it is a team. They avoided that conversation and they happened to form a litigation at the council, state medical council. But when we asked the patient when they came to the council, they were very clear, sir, we have no complaints against the doctor, but the scan center people, they misbehaved with us. They didn't communicate with us. They didn't allow us to communicate with the doctor there. If they had allowed them for a 2 minute talk with the doctor, problems would have solved there. That is what I wanted to convey, that communication is the sole reason for major problems which happen in our day-to-day practices. So apart from learning your knowledge, the skills, clinical skills, what you nurture during your MBBS time, it is also very essential to observe what your seniors or your professors, assistant professors, they talk day in and day out with the patients, how they communicate. Uh, and you should also know that there are good communicators and there are bad communicators. You should be able to judge who is communicating well. You can observe when two people are communicating, you can observe that the person who is talking and the person who is listening, whether he is grasping or no. This sense of knowledge of grasping through communication, if you develop that, then you will imbibe good communication skills during your tenure in the MBBS. Movements that matter. The critical movements which usually trigger problems are breaking bad news. Whenever there is a bad news which you have to communicate with the patient, handling conflict. When there is a small conflict which happens, it might be with the doctor or with your staff in the hospital, like reception, security area, or the nursing. There is some conflict. They are not happy with the way the nursing staff communicated with them, or they put the injection. Handling such situation is quite essential. Consent and difficult decisions, when a patient has to take a decisions on critical aspects of the patient's care, that is when there are critical moments to be dealt with. Unexpected complications, yeah, you do a surgery, there is a small complication. It can be a very simple complication of wound infection. Patient can get agitated. It is your duty to console them, communicate with them that it is going to be okay and what you are taking steps to rectify it. Communication under pressure. If you are under pressure and you want to communicate, patients are intelligent enough to grasp that you are under tension and you are not communicating well. So such small movements can change outcomes. So what does communication during this crisis mean and how you have to deal with it? There are 5 C's of crisis communication. You should be calm. You should have clarity of what you are going to speak to them. You should have compassion. You should connect with them. Then only you will be able to communicate and resolve the solution very well. You should have consistency in doing this. This doesn't come over after listening. I'm 100% sure not even 1% will follow what I am speaking now. But This is a habit. You have to create these habits on day-to-day basis. That is why clinical classes are very important. I see nowadays lot of medical students are not attending your clinicals. See, clinicals is not to learn uh, very significant things which will help you in your NEET exams or your entrance exams, but it will help you in lifelong how best you will be a doctor and how best your practice develops. So consistency in learning these skills is very important, and consistency in delivering these communications is also important. Uh, Contemporaneous, that is, you have to contemplate what the patient is grasping by their facial expressions, the way they are responding to your communication. That is also a practice which you will have to develop. And whatever you communicate has to be documented. If you don't document and if you only communicate, in the court of law, it doesn't stand. So communication and documentation is very essential. I would like to give you an example. A patient of post cesarean or post delivery develops a postpartum hemorrhage. A patient is deteriorating, hypotension is happening. Patient relatives are made to run around to get blood. They are agitated, they are angry. So, how do you manage this? The crisis worsened by mixed messaging. Like you are there, your nurse is there, she communicates one thing, you are communicating one thing. There is delay in updating the patient on patient status as of now, and false reassurance. Never do this false reassurance, because tell what is exactly happening and what steps you are taking. Patients are convinced and what they need to do during this crisis situation. If you do that, it will take hardly 5 to 10 minutes. If you do that, most of the angry patients get relieved. So, importance of communication, when to do it and how to do it. Time spent communicating may prevent years of conflict. If you don't communicate well during that crisis situation, patients will get agitated, they will go home unhappy. After that, they will tell that story to n number of people. One of them may say that you file a case against the doctor. So, this is how things get escalated. Breaking bad news. This is a well established principle on if you happen to read books. There is one book, there is one web series on breaking of bad news. This is a well established platform, or there is a series of events which you have to do when you are breaking a bad news. That is called as Spikes framework. If you see that this box is lying on a triangle, if you if you only do setting up and perception, the box will drop on the left side. If you only show empathy or strategy and tell them this is a strategy I'm using, then the box will fall this. All 5 steps are very essential when you are breaking the bad news. What does setting means? You have to set a meeting with these patient or patient attenders. That is, bring them to a room where you can coolly make them sit and you also sit. Have perception. Understand first what they know about the patient. Invite them for this discussion. Ask them what all they know as of now. What, because every time the patient relatives might change. The first person whom you have explained, and later on there is a new person who has entered who will not know anything. So whoever is sitting for that breaking of bad news with you, have the perception of what they know about the patient. Invite them for this discussion. Then transfer the knowledge. What is the transfer knowledge? You should have the documentation of what all the investigation you're doing, what is the present situation of the patient. You explain them in detail with the evidence, what evidence you are having. Then next is show them empathy, that something is going wrong with the patient. Patient might not get well, or he might take more time. They might end up spending more money. All these things, connect with them empathetically. Then form a strategy. Last comes the strategy. Then explain them what you are planning to do for next care of the patient, which can either go right or go wrong. If you do all these 5 steps coolly, it might take maximum 10 to 15 minutes. So if you don't spend this 15 to 20 minutes, you will end up in problem. Most of the times what happens is we all practitioners are busy. So what I do is when I finish my ICU rounds, I'm going out. A patient attender whose patient is bad outside, inside the ICU, comes and meets me in front of the ICU. I'm rushing to the next floor to see my patients. I'll say, patient is not good. He's not doing good. I don't know, he might get well, he might not good, we are doing our best. These are only the 3 sentences, that too on a walkway in front of the ICU without making them sit. If I deliver this and run away to do the rounds, you will end up in problem. Because patients they don't have understood, have not understood what is the situation, present situation. They have half knowledge of that, and they are not confident enough on how you said them, what you are doing, what you are not you are doing, and what will be the outcome of that. You have not communicated anything. If you do that, the patients are in soup, and they are in search of people who can tell them what is going on with the patient. They are in need. Imagine the same thing happens to you when one of your loved ones are in ICU. You will definitely feel bad. So I repeatedly tell this in all my talks, especially in medical ethics. What is good medical ethics is, whenever you are giving any options of treatment to your patients, whenever you are taking care of the patient, think that you are treating your own family members. You will never have any problems if you do that. Next is things never to do. Avoid arguing. If a patient starts telling, I know this, I know that, don't argue with them. Convince them in your own way. Blunt technical knowledge. If you start using more of technical language when you are explaining patients might be educated, they might be uneducated, they might be from rural area, they might be from urban area. So understand what is their knowledge level, communicate with them in their own language. That will be more easier for them to understand. Early defensive explanation. Before they have accepted the things, if you start having defensive mechanism, they will definitely grasp that you are talking defensively and there is some problem. These action worsen family grief and communication breakdown. Handling tense situation and safety. Early signs of it. You should also know when to escalate and when to understand that the patient is not happy with your communication or your situation in the hospital. So few of them are they staringly look at you, repeated questioning. They start recording you. One of the relatives who are standing there starts recording on phone. Crowd formation. Initially there will be only 3 or 4 people with you, the patient. Suddenly there is a mob of say 10 people starting questioning. These are all signs of escalation that they are getting angry. They start talking in a higher tone, accusatory tone. Recognize these early signs and bring in a solution. Either you communicate with them what is the situation of the patient, or ask some of your spokesperson of your hospital to communicate them using the spikes model. De-escalation pressure. Lower the voice, sit down, one spokesperson, listen first. Listen what all they want. Don't interrupt them. Let them talk what all they want, and then you start. Document everything what you have communicated. Escalation often starts when nobody feels heard. It's common. If you go to a restaurant, you find that the food is not tasty or it's not hot. What you usually do, you start blaming the waiter. Then when he feels that he is helpless, if you sense that, suddenly what you will do, call your manager. This is the routine thing which we also do, and same thing patients also do. If they feel that they are not heard of, they will start escalating and making problem at the situation. Some medical legal lessons out of all this. Common causes of complaints, usually communication failures, poor expectations settings, documentation gaps. What is communication failure? I have already told you what are all the simplest communication errors which happen. Poor expectation settings, that you give them high expectations when you start the treatment and things don't go in the natural way or your expected way, but patients have in their mind that this is going to be a good outcome or good expectation out of that, then things go wrong. Then it is your duty to call them back, tell them that day's situation, what is going right and what is going wrong, and how you plan to correct it. Then there is something called as documentational gap. Like you communicate one thing and it is not documented. Like consent. When you take a consent of a patient for any procedure, you would have told them when you are telling everything. Some complications you would have told. But when you are taking the consent, all those fields of complications which has to be there in the consent form will be left blank. So that is significant. You should fill in all those things what you have told to the patient. Many negligence allegations are disguised communication failures. There is something called a safety triangle, that is communication, documentation, and clinical competence. Nowadays, everybody speaks of evidence-based medicine. I would like to differ. It should not always be evidence-based medicine, but it should also include your clinical competence, communication, and documentation. All three are important to balance this triangle. And if you miss one of them, you will be in a soup. And same thing happens in when there is something called as Boehm's test. What does Boehm's test is? It is a legal term or a principle on which all the medical negligence cases stand. That is, whenever there is a negligence or a litigation, it has to be proved that if a normal doctor, that is any doctor of that specialty or of that concerned case, would have dealt in that given situation, if he has done the right thing, then there is no negligence. So if you consider Boehm's, your clinical competence is important. What you have communicated with the patient is important, and what the documents say about your communication and clinical competence. All these three are interlinked, and it is very important to have a safe practice. Few points on what medical schools often don't teach us. I have experienced this, but now it is good that NMC or the MCI has brought in communication skills in the curriculum. But believe me or not, many of you as a medical students, you are not bothered about the patient care, because from first year of your MBBS, you are more concerned for your NEET PG. Please don't do that. Spend at least 1 to 2 hours in your clinical postings, observe things, what is going on with the patients, talk to the patients. Then only you will be a successful clinician. Otherwise, you will have lot of failures in your life. So please take care that you attend your clinicals, discuss with your staff, discuss with the postgraduates who are there in your wards, what is going on wrong, how they communicate with the patient, how they sympathize, empathize with these patients, learn them. Lesson 1, which is not taught, never underestimate the patients. When we were doing our MBBS, a lot of patients used to be from rural background. They were unaware. Whatever you say would be a Bible or Bhagavad Gita for them. They used to feel that whatever doctor says, might have heard Vaidyo Narayana Hari. It is because it is not that doctor is called like that because he heals or he helps patients in healing. It is also considered that he has gained that knowledge to heal. So he knows about knowledge, about the clinical medicine. But now in this digital era, it is everybody has their on the fingertip. They need not even type. If they put the mic on, they say patient has this, and you get all the possible things. Gone are the ages of Google also. We used to say Google se पढ़ के आया है, या they have got Google. Now with AI, it is even more better than Google, because whatever they say is recorded and they get the solutions out of that. Not only this, because of the digitalization, because of the phones, I like to give one example. There was a patient of gallbladder stone with choledochal, that is CBD stone. He had obstructive jaundice. I was examining him in the casualty. He had already got his investigation. I was going through. I was just speaking to one of his patients, and immediately I see outside my casualty there is one person who is on a phone with another of his relative who is a doctor or some medical professional, discussing this case with them. So this is the way the communication goes on these days. Never underestimate the patient's knowledge. Everybody is well connected now. They have ample amount of information in their hand. So explain them all possible means of treatment which is there for that condition, and give them option, give them time to decide whether they want to get treated here or whether they want to take the second option, which the option is not there available with you. So give them option, let them choose the treatment for them. Accept failures. This many of us are not taught in medical colleges. as I told you about the lorry driver or any driver for that matter, if he says that I have not had any accidents in my lifetime, then he is not either driven or he's telling lies. Same way, if a doctor says he has never had any complications in his lifetime and all the patients have got well, that is not true. It is, we are also humans and it is born to to make mistakes or to have complications, because every patient reacts differently, so complications are known to happen. My boss, when I was doing my MS general surgery, he always used to tell, complications are known to happen. If you don't identify the complication and if you don't treat it in on time, that is negligence, or you are not right if you do that. If complication happens, communicate that with the patient well and take necessary steps to correct it. That is a mature doctor, and he never confronts with them with honesty. You should confront them with honesty. Lesson 3, spend more time before and during the treatment. What we do is, when a patient comes to the OPD, we communicate them, we tell them this is the surgery I have to do, this is the treatment I have to give. All that we spend some time, maybe 10-15 minutes. What happens? I do surgery and I go away, and I am busy with other surgeries or other people, other patients, and I fail to communicate what is going on with this patient for next 2-3 days with this patient. I just do the rounds. Patient ठीक है, we go away. If this happens, there is lack of connect with the patient and patient attenders. That is when they start feeling they are unheard of. Few extra minutes today may prevent 5 years of litigations. If there is any case of litigation comes, you never know. You will have significant mental agony. So start practicing from your day one, that how to communicate, how to resolve the issues, how to handle the complications, and how to handle the failures. Lesson 4, do not practice in haste or only for money. I routinely ask all the young professionals who have joined medicine, why you have joined the medicine. Some people are confused. Some people say they came because of the pressure from the parents, or they just saw their friend joining medicine, that's why they joined. Some bluntly say that I want to make more money. This happened to my nephew who was in UK. When I asked him, why do you want to become a surgeon or a doctor, he said, I also want to go around the world. I want to go have good cars. I want to have good money like my uncle. That is me. I said, don't choose medicine. If you have passion to the medicine, if you have passion to practice medicine, then choose it. Ours is a service-oriented field. You have chosen this subject. You have chosen to treat the patient. Have a service in your mind. Any service oriented profession. You take a hotel business, you take a lodging business. The more good service you give, the more clients you will have, the more money flows. So I always tell everybody that money is a byproduct in our profession. It is not the sole source. I don't deny you should make money, but don't, once you finish your degree or your post graduation, don't have in your thought that within a year I will make so much money. You develop these good skills, you develop your good communication, patients will come to you without any matter of advertisement or in the present area, social media, nothing. You talk to them well, you counsel them well, you treat them well. Patients, they themselves will go and tell 10 or 20 people that this is a good doctor, he communicates well, he treats well, and patient is happy. So they will get you more patients. That is how this service related profession leads life. So avoid rushing or intervening. Don't hurry to do a procedure. Don't hurry to treat a patient. Communicate well, treat them well, then automatically you will earn. And the only thing you will have to prioritize is excellence in your field. As I told you, medicine is a service profession. Humility increases trust. The more humble you are, the more you will flourish. Lesson 6, work-life balance is a patient safety. How does it correlate? You are overworked, you are stressed when you're in during your practice. The next day you go, you will not treat whatever patients you see, you will not treat them well. You will not communicate them with well. That is called as burnout, which causes errors and compromises care. So have frequent breaks, have good peer groups where you can discuss your problems, take holidays, and develop some type of habits, which hobbies or habits or sports where you can balance yourself and de-stress yourself from your routine work. That will improve the patient safety also. Lesson 7, take holidays. As I told, rested doctors are safer. Family and friends support emotional balance. So you should know how to balance these things. It doesn't mean that I'll practice for 5 years, day in, day out, and then I'll take holidays, then I'll go out for holidays. No, that is wrong. From day one, plan yourself, plan your year, plan your day, how you want to take a break, how you want to have food. I've seen people who sit in OPD from morning 9 o'clock. They have good meal in the morning. They go to their house only at 4 o'clock or 5 o'clock to eat food. That is wrong. You should plan yourself. Patients will get adjusted to you. Many people, they start their OPD. When I joined my father, who's a physician, he used to start OPD at morning 8:30. Everybody was surprised. How come 8:30? How come patients will come? And there used to be people waiting for him at 8 o'clock in the morning. So it is how you set your routine. Patients will get adjusted to that routine. You say, I am going for lunch at 1:30. Patients will wait, except for emergencies, which you will have to handle. 1:30 to 2:30, you plan your days. That is how you balance and de-stress yourself. Taking these small breaks also causes decrease in stress. Lesson 8, build a positive professional circle. Have your own group of friends, peer groups, that is doctors. Not only doctors, you should also be part of other social, maybe organizations or a group where you can discuss out other things other than profession. So by that, I and my friends, we usually keep saying, don't avoid attending marriages, don't avoid attending funerals, don't avoid attending functions in the family. You go there, people will recognize, dekho, doctor has come. They will come and treat you. They will talk to you sweetly. These things matter significantly in life. Don't try to avoid them in your busy schedule, because they also de-stress you. They will help you in having safe practice. When in problem, these own doctor friends or social friends will come and help you during the crisis situation. So have a very good group where you can discuss your difficulties. They will give you n number of. I like to give one example. We frequently go out, my friends, professional colleagues, we go out in my place. Gadag has a very good environment. One pediatric surgeon, we went out of for a dinner one night, and he was quite stressed. He tried to remove a foreign body from some 5 year child, and it was sitting very distally in his secondary or terminal bronchiole, which he could not remove with his routine bronchoscopic procedure. And he tried for almost 1.5 hours, and he tried to explain it to me. "Hey, today was very stressful. I did like this, and it could not do. Unfortunately, we abandoned the procedure. We could not remove the foreign body." See, because he shared his difficulty with me, an idea struck to me. I said, why can't we try out with a ureteroscope, which is quite lengthy, thin, and it has a working port? He said, yeah, we can try that. Then he said, tomorrow I'll again talk to the relatives. If they agree, we will do that procedure tomorrow. Patient relatives agreed. I took my instruments to his hospital. We did the procedure. Within half an hour, we could remove the foreign body. See, communicating and will not only solve the problems, it will also de-stress you. It will also help the patients to get better well. Because if I say I know 100%, I know everything in this world, I'm wrong. That is the end of my clinical profession. Share your difficulties, share your complications with your peer group or closed group. You will do much better in your life. Avoid negativity. Choose your group very wisely. There will be some people who always speak negative. Hey, what is there in this profession? There are only conflicts. There are only patients. They don't compromise. They don't appreciate what you do. No, If your self-consciousness says that you have done well to this patient, that is more than enough. You are satisfied. You are happy. So stay around solution builders, not destroyers. Lesson 9, have passion. Money flows. As I already told, money flows excellence. Pursue mastery, not income. That means master in whatever field you choose and develop that skill and go on improving your skill, whether it is communication, whether your clinical skills or a surgical skill. This reminds me of a very famous movie dialogue from Three Idiots, where Amir Khan says, कामयाब होने के लिए नहीं, काबिल होने के लिए पढ़ो, सक्सेस के पीछे मत भागो, एक्सीलेंस का पीछे करो, सक्सेस जक मार के तुम्हारे पीछे आएगा. This is a very good statement for this. So remember this and you will succeed in your lives. Lesson 10, medicine gives you immediate gratification. No other profession, believe me, no other professional will give you that gratification. When a patient whom you have done surgery or you have treated him, who was in his bad times, comes back and tells thank you. They might not say thank you to you. You don't expect that thank you also. They coming and telling you, हाँ, मैं आराम हुआ हूँ, ना आराम आगे नहीं. These are the words. If they tell you, that is more than there is no other materialistic pleasure which you get rather than a patient coming and telling you this. Not all patients might tell you. Don't have that expectation also that patient should come and tell you this. But a follow-up patient comes to you and say, ठीक हुआ हूँ, that is the most, and that is the immediate gratification you get. For example, if you want to compare with any other profession, a software guy develops a good app. For him to get gratification, it will take 6 months because that app has to go circulate. Everybody should use, and then it get monetized, and everybody appreciates. That is when he gets that gratification. But believe me, a patient gets well within 3 days, or you do a surgery, he gets well within a week. He comes back to you for follow-up and says, I'm absolutely fine. I'm taking orally well. That is the most gratifying, immediate gratification you can get in any profession in this world. Relief of suffering in a real time is a unique privilege. Emotional reflection, no materialistic satisfaction is more than this. Some 10 commandments. I'm towards the closing of this talk. You should learn to listen. Whenever you are communicating, learn to listen. Explain well, document well. You should stay humble all through. Accept uncertainties. You should not say that I do everything and there are no complications. You should accept uncertainties. Avoid haste. Don't be in a haste to do any procedure or without communicating or without taking consent. Protect balance. That is what life balance I said. Choose good peers, good circle, good group of either doctors or non-doctors. Work with passion. If you develop the passion of working, then you will be successful. There is no doubt. Remember why you entered medicine. Always remember why you entered medicines. And I would like to again stress, whenever you are treating any patients, have in mind that you are treating your own kith and kin, then there cannot be any problem which you will face in your life. Final message, competent enough to heal, humble enough to listen, wise enough to live well. So patients may forget medicine, but not how we spoke in their moment of fear. Clinical skill may save lives. Communication preserve trust. Character sustains a career. Thank you. And any one of you would like to have any discussion, my email ID and phone number is here. You can take down, you can message me for any type of help or suggestions or guidance you require. And I once again thank Dr. Jaspal sir, Srinidhi and other MSN team. You people are doing great work. Congratulations, and hope to see the conclave coming in a very good, real, great and large success to that event. Thank you.
Thank you, Dr. Pawan. Srinidhi?
Yes, sir. Mokshit, are you there?
Yes, sir. I'm continuing.
Yeah, I'll continue.
Thank you, sir, Dr. Pawan Kumar Patil, sir, for those invaluable lessons, understanding the communicating nuances of our practice, and is the first step towards becoming effective clinicians. Sir, so the session is now open for questions.
There is one comment. Please think patients as patients. If you think them as family members, your decisions are biased. I would like to differ here. See, think patients as patients also. But if you're treating your own family member, there are two schools of thought. Some say you should never treat or never operate on your relatives. Some say because you get emotional with them and there are problems which can happen while you treat. Believe me, I have operated on n number of my relatives, including my own sister, my own aunt. Highly complicated cases also I operated on my relatives. When they are on operating table, they are just patients for me. But communication, that is other aspect of it. But if you counsel the patients as if you are counseling your own relatives, that is a different topic altogether. So just a clarification on one of the comments.
Sir, I have one question, sir.
Yeah, tell me.
Sir, in a resource limited and high patient load setting, where you come across like interns will be busy all the throughout their days, so where communication is a problem for them. So, what is the one essential advice that we should in the internship should keep in mind while communicating with the patients and in that busy schedule?
Yeah. During internship, you sit along, you see patients independently, or you sit along with your professors and assistant professors, teachers. You sit along with them, right? So,
Yes, sir.
and you are allowed to see basic cases. So my advice to you would be, whenever your professor or a teacher is talking to another patient, a more complicated case he is dealing with, also observe how they are communicate with them. Try to inculcate those and communicate. It is not that from day one you should communicate everything. It is a habit. Every day you communicate little more. Then there is nothing called as busy. See, if you say your internship is busy, tomorrow you will have to I'm really surprised some clinicians see 100 200 patients in a day. That is highly impossible. If you communicate without communication, it is highly impossible to do see 100 patients, and I would not advise also to do that. Because if you have to clearly examine a patient, clearly communicate what you want to do and what is the case to the patient, you will require minimum of 10 minutes. Minimum of 10 to 15 minutes you will need with one patient. You work say 10 hours a day. Calculate now how many patients you can see in a day. It's a simple calculation. I accept our population is huge. During your training, you are exposed to too much amount of work. But still, it is how you inculcate these small habits during your training session, so that these can come into place when you start practicing on your own. So during this time, you should try to not only communicate, you should also try to grasp good things from your teachers. Not all teachers might be communicating well, but it is your duty to grasp good things from people who communicate well. I bluntly say, my boss, he used to say, "कौन किया है surgery? गलत किया है." See, that is a wrong way of communicating. I bluntly say, my boss. But there are good things also. So you should know what is right, what is wrong first. Grasp what is good from people who are talking like that. Grasp, leave apart what is bad. So from both you should learn. One from whom you should learn what to do, and from one from whom you should learn what not to do. Yeah.
So I had a question.
Yeah.
So good evening to you. The session was really nice. I'm an intern and I was the past state co-convener for IMA MSN. So we have seen so many instances of the violence on doctors. There are at times when they get agitated and angry, most likely because at times they don't try to understand as to what's happening, or they just feel that we didn't try enough.
Right.
When we're breaking out the bad news in case of spikes protocol, something, how do we in a hospital setting try to be not in a way dominating to the patient, but you know, like put the setting such that we can tell them and convince them. Like, how do we work on that?
First and
Because the
foremost,
momentum.
if
Yes, sir.
first and foremost, if you have heard my talk, first and foremost is you should identify when there is escalation of the anger of the patients. Once there is an
Yes, sir.
escalation, you build your team. Then call them for a meeting. Whoever is there, might be 4 people, 5 people, call, or there might be 100 people. Call 5 people out of that, arrange a meeting in a room, not in a corridor. Most of the times, what we see is most of the communications happen in the casualty in front of patient bed or at the nursing counter. That should never happen. And believe me, I am part of the state violence team headed by the chief secretary. We have had multiple 2 3 meetings, and I have stressed upon saying that there should be a counseling room sufficient enough to accommodate at least 10 to 15 people, which should have an audio video recording as well, so that there can be a proof on what all you have communicated, and all counseling should happen in there. I might not say that every patient counseling should happen there. At least when you feel that this patient is getting agitated, he is calling out for crowd, he is getting angry, such patients, at least you call them inside, make them sit, call for your superiors or seniors or to your teachers, make them sit with them and talk to them. It is not only your duty, it is also the team effort which is needed.
Yes, sir.
Hope I have cleared your doubt.
Yes, sir. Thank you so much, sir.
Thank you. Any other? Somebody has asked for, sir, attendance code, please. What is it?
Actually, that is a certificate link they have asked
Okay.
to obtain a certificate of attending this.
Okay.
Srinidhi, could you help them with this?
Yeah, he has already posted it. Attendance
Yeah,
code, he's
yeah.
posted it.
Okay.
Excuse me, sir. I have a question.
Yeah, tell me.
Sir, in situations where a patient's family asks us to withhold a serious diagnosis from the patient, how do we balance like
Yeah,
keeping in
it
mind
is
their request and as well as
true.
yeah.
It happens to us also. Especially these are the situations where, especially with respect to cancer, most of the time it happens like that. They don't want the patient to get worried and they reject for the treatment, something like that. They have their own concerns. It is our duty that first convince the patient relatives, make them sit, make them understand what is the situation, and happens if you don't communicate, and what happens if you communicate with the patient also should be explained to the attenders. Communicating with the attenders first, convincing them that telling this diagnosis and the future plan of treatment with the patient is very essential. That is what you have to communicate with the attenders. They will also take some time to adjust. If they really want to take some time, give them some time. It is not that immediately you will have to go and rush and tell the patient also. Suppose you have diagnosed a cancer of a patient. The patient attenders would like to make the patient sit outside. You call them inside, tell the patient relatives about the condition, the treatment, all the treatment plan, everything. Then they will tell you, sir, please don't tell the patient about the cancer. She will get frightened and she will not come to the hospital. Yes, that is true. So then and there you tell them that one or the other day the patient has to be communicated, because the complications of the treatment or the like for example chemotherapy, she might have hair fall, she might have excess vomiting. If she is not aware of these complications, she will end up losing she will end up losing faith in you. She will start blaming, a doctor is not good, He is giving me a treatment where such things are happening. So communicating to the patient is also essential, but not immediately. So the patient attenders will also need some time to digest and then slowly communicate. Maybe after 1 week or in the next visit, the patient attenders would also have got convinced in communicating with the patient. This is how you have to communicate. There is no condition which says you should never communicate with the patient directly. But if the attenders say you need not communicate immediately, but take some time and communicate in the next visit.
Right, sir. Thank you so much, sir.
Thank you.
Good
Dr.
evening.
Pawan, can I speak?
Yeah, ma'am. Good evening.
Yeah. Good evening. Yeah. Excellent tips, practical tips you have given, and each tip that you spoke, I could correlate and understand exactly what you are trying to mean. It was very good, and my message to the group, particularly to our youngsters, is you as interns, you as PGs, you as junior residents, you need to speak less. You may know thoroughly well, but when every time a patient or a relative encounters a doctor, they will try to extract some information or the other. And the doctor in charge, the surgeon who has operated, is the authority. The professor is the authority to speak. So if you are posted in a unit, it is the unit head who is going to speak, and it is not any of us as juniors. So this communication is an art. The phrases that you need to use when you speak to the patient with respect to anything for that matter is very important. And practically, I have noticed that our juniors, particularly when they are out from the college, they have enough of information. They are bubbling with lot of knowledge, and they would like to speak out. But keep that speaking to your clinical presentation. But with the patient, keep a barrier. Speak less. The least that you speak to the patient as youngsters, as young doctors, is the message I would like to give you. In due course, you get the authority, you learn, your experience teaches you how to counsel, how to speak, etc. Till then, communication, it's not the question of you being busy that matters. It is the question of what words which your professor did not want you to speak that you would have spoken, and you would have damaged your professor's image rather than doing favor to the patient. So patients are very inquisitive. They'll try to misuse us, so we should speak less. The example that I would like to quote is, if the chief minister is is speaking to the press, have you noticed, does anybody else speak? Only he speaks. The person behind knows fully well that he's not speaking properly, but nobody opens their mouth. That is because of the efficacy. So kindly maintain the same efficacy, but as you grow older in your profession, it is going to help. As Dr. Pawan put it, be sincere in your work with respect to the success in terms of name or fame or money or anything is going to follow. Make sure that you are dedicated, that you maintain ethics in your practice. This is all that I wanted to say. Thank you.
Thank you, ma'am. Dr. Pawan, sir.
Thank you, Pawan. It is nice
Thank you.
gesture.
Thank you, sir.
Pawan, sir, there is one question in the chat box.
Yeah.
Sir, the Kirtana is asking how to not get emotionally attached to a particular patient or patient's family.
It comes over a period of time. Definitely, there will be, see, we also feel bad if a patient goes bad and patient dies. We also feel bad. Just to give an example, second wave of COVID, it was totally disturbing and depressing, because young patients, even whatever guidelines was there, we were treating, we were giving them everything. They were going bad and they died. Young teacher. It was quite depressing. It is part and parcel of our profession. We have to learn how and to move ahead. That's it. It is a practice what makes you like that. So that is when the thing I told you is take holidays, take a break, communicate with your peer groups. That will ease out you significantly. Emotionally getting attached is bound to happen when you communicate well, when you but again, when if after discussing it with your peer group, things settle down.
There is one more question, sir. Some patients calls doctor home as a friendly gesture. Should you attend?
Yeah, you can attend them, but as far as possible, don't treat them at their house. Even if you treat, have a documentation out of that. See, you will attend earlier days. If you see, that will give good patient connect. Assess the patient why they want you to attend. There will be a bedridden patient who cannot be shifted to the hospital. They want you to come and see the patient. It is a gesture. If you have time, if you are available, I attend. Even today, I attend a lot of patients at their house if they call me. But believe me, if you feel that you should have a good judgment that if the patient can be treated in the sense not with IV or any invasive procedures, just prescribing some medications. For that, again, excellence in your knowledge and your clinical skills helps you in deciding if this patient will be okay in the house or he should be brought to the hospital. Again, to give you an example, I received a call when my uncle, who was a chronic kidney disease, he was on dialysis. He was in Bangalore in a hotel. He called me. He called me and said, "I'm just getting a little amount of cough." But something struck to me. See, I could have simply told him take cough syrup, but something struck to me. Something is not right. So I told him go to the nearest hospital, that is Saint Martha's, where he was staying. The moment he went there, he had a SVT, supraventricular tachycardia. So he was treated. So your clinical skills, there is something called a sixth sense also in medicine, which will come over a period of time. You can the way they talk, the way they explain their problems, you will have your own diagnosis in your mind or thing. So that comes over a practice. Yeah.
Thank you, sir.
Only sympathy, no empathy. Both are required actually. Somebody has written only sympathy, no empathy.
Both are
Both are
required.
both are
They will
required.
learn over time.
Yeah,
It comes by practice.
yeah,
So sometimes we may have to attach to patients. Need not be always, but to some extent,
yeah,
you have to attach to your patient. Otherwise, we may lose the confidence with the patient.
yeah.
That is my
We will also
message.
lose, and the patients will also lose
Patient will also
confidence on
lose
us.
trust
Yeah,
on us.
trust on
Yeah.
us. Yeah. Somebody has raised a hand. Rudragoda Patil. Rudragoda Patil. Who is it? Hello.
Rudragoda Patil, sir, please unmute and speak.
Okay. Yeah, he's unmuted. Hello. Hello.
Didn't they conclude?
Yes, sir. Sure, sir.
Not
Mokshit,
audible, sir.
Mokshit,
Sir,
you may proceed with the vote of thanks and Chairman sir remarks.
yes. Uh, so before we, so yeah. So before we proceed to the vote of thanks, I request our chairman, Dr. Jaspal Singh, sir, please deliver your remarks.
I thank my dear friend Dr. Pawan, who has touched all the aspects he wanted to deliver to the upcoming budding young doctors in a very, very crisp and a shorter way. He has covered a lot of topics, touched everything in a proper way. Thank you, Pawan. You've done an excellent presentation. So
Thank you,
that
sir.
most of the aspects all our young budding doctors wanted to hear are covered. Uh, One most important thing is I would like to add is to all our young doctors, patience and don't lose your temper. Whenever you are into this practice, most of our young doctors, uh, because of their, as I heard, busy schedule or something, they tend to lose their, temper. Keep yourself patient, give good time, and even if you are losing temper, handle it in a very subtle way. Be very humble to the patients and be very soft, and that will carry you all a long way. Learning all these tips and tricks is not a single time job. Like as I heard Srinidhi saying that seeing so many patients, how will I be able to communicate to them? It takes time. Your 5 years are not enough. You are going to learn this over a period of time, and that is how it is, said in experienced doctor, because you understand all these things from the beginning and you know how to handle them. Every situation has got its own way of handling. So learn slowly, go a long way, and you'll all be very successful doctors. Handle them in a every case has got its own importance, and so handle every situation as and how they come to you in a very very humble and a very proper way. So this is the message I just want to communicate to our young doctors, and thank you all for listening and staying with us till this time, and making this webinar a very successful one. Thank you all. Thank you, Pawan. Thank you, Veerbhadreya sir. First of all, thank you, Harish Dharanta Bettu, who has also joined. Thank you, Madhusudan sir, who's also there from the beginning and supporting our students from the long this time, as well as all the other seniors who have been here. Thank you all.
Thank you, sir. Bye. Keep doing
Sir,
such webinars.
with your support, sir, we will be always,
Actually, very good attendance with MSN webinars,
Yes, sir.
not with others. So I am surprised.
Sir, our boys are also very, very active.
Why, sir? Yeah, that
Srinidhi
it
is
shows.
taking a lot of
Yeah,
pain and efforts in spite of
I am
his,
expecting the same from other groups,
Yes, sir.
but speaker should not be disappointed with lesser attendance. We should encourage
Definitely, yes, sir. The attendance will make our
getting in good
speakers
number.
more enthusiastic and they feel better morally also.
Yeah,
Yes, sir.
yeah.
Yes, sir.
Thank you so much, sir. Thank you.
Thank you, sir. Thank you very much.
Thank you, sir. Now I request Shreya to deliver the vote of thanks.
Good evening, everyone. On behalf of the entire IMA MSN Karnataka team, I extend my sincere gratitude to Dr. Pawan Kumar sir for shedding light on one of the most ignored and often negligent aspects of medical training. Your words reminded us that beyond clinical knowledge, it is empathy, clarity, and composure that truly defines a good doctor. Thank you so much, sir, for that valuable lesson. I would also like to express our deep appreciation to all the respected dignitaries for their presence and support. Finally, a big thank you to all the students and participants who joined us today. Thank you, everyone, for being a part of this enriching experience.
Thank you.
Thank you, Shreya. Once again, sir, Pawan Kumar, sir, thank you, sir, for joining us
Thank you.
tonight. On behalf of the IMA MSN Karnataka State Branch, we thank all our dignitaries and participants for making this session a success. Have a safe and productive night ahead. Thank you.
Thank you all. Thank you very much.
Thank you, sir.